Good morning, guys. We're live today at the Colorado Springs Dermatology Clinic. On the way, we're talking general dermatology, things you need to know for healthy skin care to keep you safe. That's coming up this hour. Don't go anywhere. Good morning, guys. That's right. We're talking total skin care this morning at the Colorado Springs Dermatology Clinic. On the way, Dr. Babcock going to talk about some of the most common afflictions people see here in this area and how to prevent that. It's coming up next. Hang on.
Dry and itchy skin can be a daily inconvenience for many of us.
This morning, Craig Coffey continues our coverage on protecting your body from the effects of our environment here. Good morning, Craig.
Good morning, guys. That's right. You know, just because of where we live, we learned early this morning that for every 1,000 feet of elevation and our exposure to the sun, it increases our risks of skin cancer alone by 4%. So something to think about just because of where we live right there. Dermatology must be a big thing in Colorado, right, Dr. Babcock?
Absolutely. I grew up in this state, and Colorado, one of the things we see here is a lot of skin disease. We see skin cancer galore. We see a lot of dryness. The weather, of course, being so dry, we have a lot of hard environmental factors that play into the way the skin acts.
Okay, what are some of the most common skin ailments that you see on a daily basis?
So I'd say a routine day for me would be acne, eczema, warts, of course, those common things. But a majority of them are going to be my more elderly patients or some people not so elderly who have either skin cancer or abnormal moles.
And is there a certain age that maybe the sun or radiation might have an effect on the body, be it maybe in children or older people?
So actually that's a good question. You know, a lot of the skin cancer I see in patients who are 60, 80, 40 even, oftentimes they'll say, hey, I'm not in the sun, you know, I don't go outside anymore. But I go back to what I was taught in medical school and the things that I learned in dermatology training, which was a lot of the sun that you receive before you're 18 years old is going to have an effect on your lifetime risk of skin cancer.
Okay, so it could have a long-term effect that might be lying there dormant.
Absolutely.
And just kind of react later in life.
Yep, I tell people their skin has a better memory than them and me.
Interesting. Now I'm scared, Doc. I grew up in South Florida, so now I'm freaking out. Yeah, okay. So speaking about that, what are some things that might be going on that people just don't realize with their bodies and their skin?
I think probably the things people don't realize is that walk to the car, eating lunch with a friend outside, those types of things where you're just getting incidental sunlight for 5 or 10 minutes here or there, that's still causing DNA damage that is ultimately going to lead to their lifetime risk of skin cancer.
Interesting. Good stuff to know. On the way, we're going to have more here from the Colorado Springs Dermatology Clinic. We're going to talk about some prevention you can do. Also, self-checks, body checks. You recommend have a date with your spouse, right?
Once a month.
Yeah. Let the party begin. We're going to do some checking. All right. That's coming up here in just a little bit. Good stuff to know today, especially for us that live here in Colorado. Back to you guys in studio.
Got to take care of our skin, that's for sure. Thanks, Craig.
Good morning, guys. That's right. We're here today at the Colorado Springs Dermatology Clinic. On the way, we're talking with Dr. Babcock here about things you should know and check for that might save your life in the long run. That's coming up next.
Welcome back at 7:37. Proper skin care can go a long way in both helping us look and feel better.
Craig Coffey this morning at the Colorado Springs Dermatology Clinic with more on keeping our bodies happy and healthy. Good morning, Craig.
I promise this is not going to hurt at all. You might feel a slight pinch.
That's right? Nothing. We're good.
That's right. That's what you say, right?
Of course.
Okay, this is Dr. Babcock. Good morning once again. I'll give that back to you.
Thank you.
For the serious doctor, yes. Okay, so we're here talking skincare. Thanks a lot, guys. And let's talk about, you know, Colorado, where we live, our outdoor lifestyle, the altitude, exposure to sun so much around the year here. It's a nice place to live, but there can be some dangers, right?
Absolutely. I say the price we pay for living in this beautiful state is we just got to be careful.
And again, yeah, just coming off winter, even now, people out there skiing.
Sure.
Big concerns out there with that snow. That's a huge magnifier of the intensity of the sun.
Yep, my worst sunburn of my life was skiing as a Boy Scout when I was young. Before the days, you know, Boy Scouts are supposed to be prepared. This was before the days of sunscreen being very readily available. Nowadays, of course, you go up skiing in ski schools. They have a big pump section of sunscreen you can use before you even get out on the mountain.
Okay, and you also just told us last segment that the majority of sun we get exposure before we're 18 years old stays with us through our entire life and that can come back later in life and I guess kind of haunt us if we're not careful.
That's true. Unfortunately, that's true. You know, when we're less than 18 years of age, we often don't act in our best long-term interest. We're looking more for the immediate gain. Things we experience when we're less than 18 are unfortunately going to stick with us throughout our life. So if you can teach your kids young, train them to go ahead and ask for sunscreen before they go out for their soccer game or go out skiing, will be much better for them.
Let's talk about that now. Prevention real quick. Sunscreen, of course, that's obvious. What SPF do you recommend that we should always wear?
I think it's like 1,000,001.
Okay, right, just to be safe, right?
I have seen some over 100 now. The thing we really need to look for is SPF 30 or higher.
Okay, 30
and
higher.
More important than that is actually the ingredients, which most people don't look at.
Okay.
What you want to do is pick up that bottle of SPF 30 or higher sunscreen, look at the back. Under the active ingredients section, you want either zinc or titanium to be the main ingredient there.
Okay. Are there certain clothes we should avoid or that we should wear that might help?
Nowadays, they've actually got a lot more sunscreen, I guess I should say sun protective clothing that I tell people is better than sunscreen. You can't sweat off clothing. You can't miss a spot with clothing. So yeah, I do like a lot of the Columbia and other brands out there.
Also, overcast day, be careful. Just because you say the sun's heat isn't getting through, those ultraviolet, the radiation is still getting through the clouds.
Exactly.
It still has an effect.
Yep. You know, when you're out there on a nice sunny day, you can actually feel the heat of the sun. That's not ultraviolet radiation. That's going to be your infrared heating you up.
Okay.
When that cloud covers, you lose that warning sign.
And that heat's a warning that says, oh, I'm getting hot, I'm going to get out of the sun.
Correct.
But when it's cloudy, you're not getting hot, you think, okay, I'm good.
You think you're safe, but you're really not.
Very cool. Thank you so much for all your time, Dr. Babcock here. Again, we're hanging out this morning talking skincare, good stuff we need to know, especially here in this area. We'll have more coming up just after 8. Right now, back to you guys in studio.
All right. Thanks so much, Craig. Good information to know. And as he said before, too, even when it's cloudy, like it's going to be later this afternoon, people probably won't be out sunning themselves. But if you're outside, yeah, you're still going to get that UV.
You can get sunburn even when it's overcast out there.
Good morning, guys. That's right. We're live today at the Colorado Springs Dermatology Clinic, the Rocky Mountain Laser Center right now. This certain part of the building. Get set. We're talking skincare, prevention, rejuvenation, reverse the effects of aging. Yes?
Yes.
Okay. The man does wonders. That's coming up next. Hang on.
You're watching Fox 21 Morning News.
It is now 8:16. Living in Colorado, we all know how our skin can be affected by things like changing temperature, altitude, sun exposure, and of course the dryness.
Yeah, very dry for this morning for sure. And Craig Coffey, thankfully he did not flake on us. He's at the Colorado Springs Dermatology Clinic. And I can't take credit for that joke. Brittany Baker came up with it, Craig, so sorry.
What's that? What happened?
I said you can't flake on us.
I can't hear what you're saying. The machines are on right now. Yeah, I'm sorry.
It was a
Healthy
good
skin
one.
and being beautiful, it's really noisy. Yes. But thanks a lot. Yeah, hey, we're here like you said, and we're talking about skincare all morning long today. This is Dr. Truckman. Good morning to you.
Good morning.
So let's talk prevention right now. Prevention as well as rejuvenation. So what are some things we can do that you offer here as far as preventative stuff like creams and lotions and
Sure. Yeah. Well, the best prevention is really to stay out of the sun. But if you've had a number of years of sun damage, there are ways you can rejuvenate afterwards. So all hope is not lost.
Okay.
So the first thing is to think about doing some of the antioxidant creams. We have a number of serums and gels that can reduce the signs of aging. And then if that doesn't work, we can also move on to some of the procedures. And those are where things get really fun.
Okay, so when you say that, we're talking lasers, right?
Yes.
Lasers. Okay, we have our protective goggles. You say right now it's a good time to get old.
Yeah, right now it's a great time. With all the baby boomers, people are getting older every day, and we can help rejuvenate them and keep them looking youthful and fresh.
Very nice, very nice. Kelly here is going to help us out. We're going to work on Kelly. You wouldn't know this. Kelly is 78 years old.
Doesn't she look great?
Looks fantastic.
Yeah.
Okay, what are we doing right now on Kelly?
Okay, so Kelly is near perfect, but she does have a few little sunspots on the back of the hands. And so what we're going to do is we're going to do a little bit of laser treatment. So everyone's going to put on their laser goggles to protect the eyes.
Goggles? Okay.
And we are going to zap a few little spots
Now,
on
this
her.
is the Q switch we're working right now,
Yeah,
right?
we have 14 different lasers. Each laser takes off either hair removal or a different problem, wrinkles, brown spots, vessels.
Okay.
And today she's got a few little brown spots, very slight, and we're going to remove a few little spots.
So then are you saying that things that happen to us as we get older in our skin and our body It's reversible?
That's right. So once we have the brown spots and little red vessels, we can remove them. So we're just going to zap a few little spots on Kelly today. So we're going to actually fire a few little pulses on her. We're going to do a little test dose. Kelly, how's that? Okay. All right.
Doctor, her hand is smoking. Is it? No, just kidding. Just kidding. Okay. But that's what that pretty much just focuses on a pinpoint location, right?
That's correct.
Now, how long would a procedure take?
So most of the procedures in our office take anywhere from 5 to 10 minutes, and we can remove the little brown spots and little red vessels from the skin and rejuvenate her.
Okay, very good. Or you can be like me and wear a lot of makeup, right? That also helps. Okay, that's Kelly. Thank you so much. Hey, boy, down at the Senior Center, guys, later on tonight. Boy, she can dance too, yes? That's it for now. Happy, healthy skin to everyone out there. Take care of yourself. Think about the measures and stay healthy. Back to you guys in studio.
It is important to take your first scan. We got to think about those things.